this educational series of Clexcel eye care services. If you are new to this channel, I will encourage you to follow us on our various social media platforms so that you do not miss out on any of this important information, which are actually intended for the benefit of you and your loved ones. Over a couple of days back, we've been talking about glaucoma, and today I'm here to throw some light on some of the tests and then investigative procedures that we as eye care professionals we employ in reaching a good diagnosis of glaucoma. My name is Dr. Richard Addai. I am an optometrist practicing in the Netherlands. When you walk to the eye care center to have your eyes checked for glaucoma, one of the very first things that your eye care professional will be doing will be to gather information, as much of them as possible, through investigative observational and then imaging procedures, to get this information, and based on which they are going to formulate the glaucoma diagnosis. I mean, to conclude whether or not you have glaucoma. And some of the very first ones they are going to do will be to perform ophthalmoscopy, otherwise called dilated eye exam, and often this is done in conjunction with the slit lamp exams. What these two seek to achieve is to gather as much information as possible regarding how healthy the tissues of your eye are. Okay, so the slit lamp exam, for instance, is going to examine the anterior segment of your eye, I mean the front part from your cornea all the way to the lens, and then sometimes in addition with other lenses be able to see the back. Essentially what slit lamp exam is doing is to magnify the tissues, okay, the anterior segment tissues of the eye, allowing your doctor to be able to see them in detail and gathering any information as to whether or not there are any abnormal tissues and things like that. And then the ophthalmoscopy also looks at the posterior segment of the eye, where we are looking at your retina, the optic disc, and then some other tissues there. Okay? So we are actually looking for any mesonorma that will help us to determine whether or not you have glaucoma. And then in these procedures, the ophthalmoscopy, for instance, an eye drop will first be put on your eye, and then you wait for a while so that the entrance of your eye will be open enough, and then allow your doctor to be able to look at things in detail. Essentially, what the ophthalmoscopy is doing is to let the doctor examine or observe the various tissues at the back of your eye. I mean, they will be paying attention to your optic disc, your retina, the macula, and then some other tissues there. Okay, noting down any mesonormal or normal tissues, and this information are going to be key in determining whether or not you have glaucoma. Okay, so having done the ophthalmoscopy together with the slit lamp exam, we would want to do one other important test that we call tonometry. And what tonometry does is to check the pressure within your eye. This pressure, we refer to it as intraocular pressure. We know glaucoma comes about as a result of a buildup of pressure that eventually damages the optic nerve. As Dr. Bismarck already explained, the optic nerve is sort of a fiber that connects the eye to the brain. It relays information that the eye gathers, takes it to the brain for interpretation. So glaucoma damaging these optic fibers kind of make you not see things. Okay, so in testing or checking for glaucoma, you want to check whether your pressure is within normal range or not, and the value that you record can also be used to, in addition to other information, conclude whether or not you have glaucoma. So in performing this tonometry, there are two types. One that puts the device directly on your eye, and then another that does not come in contact with your eye. So as the name implies, the direct tonometry and then the indirect tonometry. The indirect tonometry uses a device that kind of blows an air on your eye, and then the device estimates the pressure within your eyeball from that. The direct one, however, requires that the instrument is placed on your eye. And so because the cornea is very, very sensitive, we often have to numb the eye with some anesthetic, some local anesthetic, and that allows us to measure the pressure. We have various various types of devices for that, be the non-contact or the contact. All of them help us to get the pressure within your eyeball. Okay, but the gold standard of these pressures is the direct contact tonometry. Okay. And then in estimating the pressure within your eyeball, there is one other test that is also very crucial, because if you get a wrong value for the pressure, it can lead us to misdiagnose glaucoma. And this test we are talking about is the measurement of the thickness of your cornea, the central corneal thickness. The procedure is called pachymetry, and the device uses a pachymeter. Okay, because we know that the thickness of the cornea influences the pressure within your eyeball. So in trying to get the actual pressure within your eyeball, it is important that we get the thickness of your cornea and then do the necessary estimation that allows us to get the actual value of the pressures. Okay. So having said that, we move on to the next test, which is gonioscopy. Essentially, what gonioscopy does is to examine the anterior chamber angle of the eye. Dr. Bismarck explained what that angle is in another video, so you can go back to that video and check. It is actually one of the drainage systems of the eye, and that helps to ease the pressure within the eyeball. There is a fluid within the eye called the aqueous fluid, which supplies nutrient to some parts of the eye. And after they've been produced, they have to be taken from the eye. I mean, they have to be drained, otherwise it's going to cause a buildup of pressure. And the consequence of this buildup is damage to the optic nerve. So in diagnosing glaucoma, we want to check and see whether this drainage system is working fine. And the process of checking that is called gonioscopy. And then we use the gonioscope. The gonioscope is a system of mirrors that allows the doctor to have direct view of these angles. Okay, so it also has to be put directly on the eye, and so an eye drop will be put on your eye to numb it, and the device put on your eye. So based on what the doctor or your eye care professional sees, they is able to estimate whether or not the angle is open or not. And this information helps us to classify whether you have open angle or close angle glaucoma. These are some types of glaucoma. I'm sure we will do more about the various types of glaucoma as we go along. Okay, so having checked the angle for openness, then we proceed on to other tests such as the imaging procedures. And these imaging procedures gives us details about the tissues of the back of the eye, and then their functions, and then also their sensitivities and other matters as such. So going on from there, you would want to assess your visual field, and by visual field I mean the extent of space that you can see when you are focused right ahead of you. Okay. In simple terms, how wide you can see when a target is in front of you and then you're focused on a target. How wide you can see, that's what we describe as your visual field. And with this, there are also several ways of estimating this or assessing this. There's a quick way of doing that in a procedure called confrontation test, and this can be done in the consulting room by your eye care professional. It's a quick and easy one, but it doesn't provide details, because what happens is you sit in front of your doctor, he gives you a target to look at. It could be his nose or his forehead or something else, and you focusing on that. A target is brought up from a position of a position where you cannot see it. Okay, so it will be brought from the various sides, various quadrants, left, right, up and down, in order to assess the visual field in the various planes. And there are certain angles that correspond to normal visual field or the normal range. So if you are not reaching these numbers, then we know that at least there is an idea that your visual field may be constricted. So like I was describing, you focus on a target that your doctor gives you, and then a second target to be brought from a position where initially you cannot see. So the moment you notice it, you draw your eye care professional's attention that, oh, I can detect the target. So by the time the test is done, we have an idea of your visual field, okay, as to whether it's constricted in any way or not. As I said earlier, that one is not detailed. It just gives us a fair idea of what the visual field is like. In order to get a better assessment and a detailed assessment, we resort to computerized tests in the Humphreys Visual Field Analyzer, simply called a VFT, as Visual Field Testing. In this, your head is placed in the device's forehead and chin rest, and then you'll be given a target like a button to hold. The computer is going to project lights of varying sensitivities, a spot of light of varying sensitivities, and the aim of this is to test various parts and the sensitivity of the various parts of your retina, and then to help us know the extent of the visual field, okay, whether there is loss of sensitivity in any of these areas and details like that. So what you do is, as the machine keeps on presenting the target, anytime you detect it, you press the button which is in your head, and the test is going to go on for about 5 to 10 minutes, during which the computer gathers information that we are looking for, and then the printout of this test can be analyzed, okay, graphically and then numerically. And the data is presented in a graphical and then numerical manner, which allows us to analyze it and then determine whether there are sensitivity losses in any part of the retina or the specific area that you will be looking for. So that is in essence the visual field analyzer and the VFT, visual field test. It helps us to get the details of the sensitivities of the various parts of the retina and then the optic nerve. And then one key thing about this test is it can also help us to detect the progress of glaucoma in case you've already been diagnosed. Okay, there is a system built in it that allows us to follow your progress and then know the pattern of visual field defects. Okay, so having done the visual field and knowing the state of it, we also proceed to do some other imaging procedures like the optical coherence tomography. The OCT it's one of the current technologies that is changing the face of eye care, in that it helps us to get better view of the back tissues of your eye. Essentially, the OCT it's a scanner that allows us to scan various parts of the back tissues of the eye, and then we analyze and interpret this data to get a better understanding of what is really happening at the back of your eye. The device takes series of two-dimensional images, and then it combines them into a computer combines them into three-dimensional image. And these three-dimensional images are then assessed to know what is really happening at the back of the eye. It is indeed a powerful tool that is changing the face of eye care. It makes diagnosis more reliable and things like that. So these are some of the tests that you can expect to go through when you walk to the eye care center to have your eyes checked. Then there is one other test that I forgot to mention. Is the fundus photography. Okay, this fundus photography is similar to the ophthalmoscopy. The advantage to this is that a camera is used to take images of your eye, the back of your eye, which can then be transferred to a computer, and then we have a visual representation of what is happening there. It's just like, you know, looking at the picture of the back of your eye. That way we can spend some time to study it in detail and then know the various problems going on there, if there are any misnomers or things that we should focus on. So basically, these are some of the tests that you can come across when you walk into the eye care for glaucoma services, and then we just want to let you know some of these things so that in case you decide to go, you know what to look out for. And so, drawing the curtains on today's talk, I just want to encourage you to keep taking good care of your eyes, and then be on the lookout for any symptoms and then problems that you may come across. And we are always available. You can post your questions in the comment section of our various social media handles, and then we'll do our best to give you our professional opinions and answers. So until then, take care, then see you.